This is a special series on depression, and I'm excited to introduce Dr. Michelle Folsom, Physician Liaison at Calvert County Health Department. And I'm Anita Ray, and I am the Grants Director for Calvert County Behavioral Health. The first thing we want to talk about is depression and COVID-19. Although the long-term effects of COVID-19 have been yet to be determined, some of these things we may not be able to answer now. But in regard to the brain and the body, it has been shared by a lot of experts that survivors of COVID-19 have reported a lot of depression or symptoms months after they've actually been free and clear of COVID.
Correct.
So is depression a side effect of COVID-19?
Early on, there were a lot of studies done to determine whether or not depression and anxiety and even memory issues were more prominent. And it looked like pretty early on, and the studies have shown this, borne this over time, that you're at about a 2 times higher likelihood of developing depression, anxiety, or memory issues in the 3 months after COVID. And that's essentially independent of physical symptoms, although if you have lingering physical symptoms from COVID, we know that puts you at an increased risk of depression and anxiety as well. So the majority of those studies were early on, but there have been a couple of meta-analyses which look at a large grouping of studies, and they too still find that correlation. Many people feel that could be related to the physical symptoms. There are studies that are looked at specific for people who have been in the ICU. And so it's essentially like post-traumatic stress, but after an ICU stay. And those people certainly have a higher risk of having depression or anxiety long term. I think there's a lot yet to be seen, as you mentioned, and there are ongoing studies. Hopkins has one, I know, locally, but there's other studies that are ongoing to determine the long-term effects of COVID. Because we know now we know it's not just your lungs being affected. It's not just a respiratory illness for everyone. Some people are fortunate enough that that's the only thing that happens, or that they have mild symptoms or no symptoms. But for some, this really becomes more of a chronic illness.
So it's long-term and ongoing.
Ongoing, yeah. And we know that some of this has to do also with the depression and anxiety that can come with just being isolated.
What are some of the common causes of depression in youth?
Yeah.
And that's all ages from 5 to 18 years
absolutely.
old.
When you look at the data metrics, oftentimes the start to a lot of the data collection is as young as 3.
Really?
And it goes up to 17 typically on some of the metrics that we can find nationwide. So a lot of what we hope to do, though, is to not diagnose children that young, obviously, with anything that is potentially something that they're going to outgrow, but depression is obviously not something that all children outgrow.
So can we talk a little bit about anxiety and how that impacts depression, especially in youth?
There's not a whole lot of good data about anxiety by itself. So oftentimes it is only captured when it's diagnosed with depression or with another medical condition. But anxiety certainly plays a huge role. So anxiety, keep in mind, can have many forms. You can have generalized anxiety, which means that you're anxious about a lot of things, everything.
Yeah, everything.
You can have specific phobias about a variety of things in the world. You can have panic attacks. Oftentimes panic attacks go hand in hand with generalized anxiety, but they don't always have to. You can just have discrete panic attacks. So when someone has panic or generalized anxiety, it makes sense that they may see the world from a different vantage point or a different viewpoint, right? Everything might be more worrisome. They may not, if they've not been provided those coping mechanisms, or if they've been given those coping mechanisms but don't have a way to actually employ them or to utilize them, that can be a setup for depression in the future.
We're going to continue our series today on depression, and we're going to do depression in seniors today.
Yes.
Is there a common thread to depression in the senior community?
This is not the natural progress of aging. So I think one of the misconceptions is that people will automatically become depressed as they age. For detection of depression in seniors or causes of depression, in older people, we really have to sort of be mindful that there's a lot of other things at play in comparison with younger people. We would say that some of the causes of depression in older people might be if they've had a prior diagnosis, for sure. So if you were younger and you had depression in your 20s or 30s, that may make you at increased risk for developing depression down the line. Some other things that you want to keep in mind with the older generation of people is oftentimes isolation can affect people, and tying a little bit back into our COVID talk, but isolation certainly can impact older people. As they get older in life, they might not have the friendships that they once did, either because some of their friends have passed away, or maybe they're isolated physically because of a limitation they have. Stress can certainly play a role, just as at any age, in triggering those depressive symptoms. Lack of physical activity, and we'll get to that a little bit more later, but lack of physical activity and mental stimulation can be problematic for senior citizens. Medical conditions, we know certainly that there are certain medical conditions that predispose people to developing depressive symptoms. Whether or not they meet the qualifications of depression is a whole other thing. Many women, after they go through menopause, will have some hormonal shifts. Just as we spoke about in the young, there's also this change for women as they go through menopause. And then I don't want to discount also, there's a large portion of the population who are senior citizens who do have substance use disorders. More commonly in this age group, we see things like alcohol, or maybe the use of pills for chronic pain or a chronic condition. And so substance use can also lead to or coexist with depression.
Are the signs and symptoms in the seniors similar to what it is in youth or other age groups, or do they have a different way of outsiders detecting that they may be depressed?
Well, and to focus back on those symptoms, just to sort of remind ourselves what depression really classically is. So it's sadness, lack of interest, increased guilt or feelings of decreased self-worth, energy changes, typically more on the low energy spectrum, although some people can certainly present with a higher level of energy. Concentration difficulties, appetite changes, psychomotor slowing, so slowing of thought, slowing of movement, and then thoughts of suicide.
What age would you say that is?
I think most people set the bar now at around 60, although certainly some people will go as low as 55. But certainly 60 and above, we're looking at that. You know, if somebody meets 5 of those criteria over a 2-week period and it creates enough distress in their life, we would call that clinical depression or depression that we would want to treat. I think some of the things that are more difficult to look at in seniors is that on average, your community dwelling senior citizen is on somewhere between 5 and 7 medications. And then for people who are in nursing homes, they on average are on about 7 medicines. So the upper end of that spectrum. And some people are as high as 9, 10, 12. And so we call that in medicine polypharmacy. If you're on medicines that maybe make you more tired, maybe they affect your cognition in some way, maybe they affect your appetite. As we get a little older, you know, our stomachs can get a bit more sensitive. So those sorts of things can certainly be masked by medicines. That being said, if you truly meet the clinical diagnosis of depression, sometimes, surprisingly enough, if you go on an antidepressant medicine or get counseling, some of those symptoms that you might have had as a result of other medicines or that caused you to be on these other medications could go away. We just have to think about medications more prominently as people age. You know, if somebody meets 5 of those criteria over a 2-week period and it creates enough distress in their life, we would call that clinical depression or
depression and diabetes. And this is the somatic piece that combines with the behavioral health piece when it comes to depression.
We have type 1 and type 2 diabetes.
Yes.
The majority of what we're going to talk about today is type 2 diabetes. Type 1 diabetes, it's its own separate entity. I like to think of it as almost its own separate medical diagnosis.
Okay.
So type 1 diabetes typically presents in young people. It presents suddenly, typically. People become very sick very quickly, and they need to be hospitalized and put on insulin because they can't live with the insulin that their body is currently putting out. So their pancreas gets shot for some reason, and they need to be on insulin. So that's a type 1 diabetic, and usually the symptoms are rapid weight loss, anorexia or loss of appetite, really severe frequency of peeing, frequency of thirst. For type 2 diabetics, what happens more commonly in my experience was that people would come in, maybe their family members had been diagnosed with diabetes, maybe they'd gained a little bit of weight, became less active as they got older, and maybe they just got detected on screening. So they got blood work done and it showed that their sugar levels were high. For some people, they do get other symptoms. So increased thirst, increased or changes to appetite, and increased urination are signs that you need to be screened for diabetes. The other thing that sometimes people don't think about are yeast infections. So in men, those can be under the armpits and the foot and the feet, although typically foot fungus is a little bit separate. And for women, certainly yeast infections in the genitalia region needs to be evaluated if it's happening recurrently. And then some people will start to have things like vision changes, extreme fatigue and lethargy with diabetes. That's usually if it's gone on for a longer period of time or if their sugars are really high or really low.
So what's the link between depression and diabetes?
The prevalence of depression in type 2 diabetic patients is 2 times the general population. So if you have diabetes, your depression rate is 2 times what you would see in someone who doesn't have diabetes.
Wow.
Okay, 2 times. And we do know it's bidirectional. So it also impacts those people who have diabetes. They have an increased likelihood of depression, but also for people who have depression, they have an increased likelihood of diabetes. Type 2 diabetes is associated with a 20% increased risk of depression happening afterwards. And depression is associated with 60% increased risk of diabetes developing afterward.
If there's one thing that you would like to share with our listening audience about diabetes and depression, what would it be?
The big message right now is get screened. Take a screening quiz, either ours or somebody else's, get tested and get treatment for diabetes. And then for depression, please reach out to your medical provider, reach out to whomever is close to you. If you're feeling like you need help emotionally for your emotional well-being, please reach out, get the treatment that you need.